A very warm welcome. I am really excited to be here speaking about our undergraduate degree. My name is Dr. Nicole Blackburn and I am the course director for the Bachelor of Science Honours Health Physiology and Healthcare Science programme here at Ulster University. The team are delighted that you are considering applying to complete our programme of study. So what is health physiology and healthcare science? Healthcare scientists and the clinical services that they lead encompass over 50 areas of scientific and clinical expertise. These areas span pathology and laboratory services, physiological sciences, medical physics and clinical engineering, and data science. The workforce are involved in all areas of the patient pathway, from primary prevention, diagnostics, through to rehabilitation services and impact clinical decision in the patient journey, contributing to over 80% of all diagnostics. They prevent, diagnose and treat a wide range of cardiovascular, respiratory and sleep conditions. Hence, our graduates are equipped with the knowledge, transferable skills and professional standards to contribute to a range of areas in and around healthcare through numerous career options. According to the Academy of Healthcare Science is a broad term encompassing a highly diverse scientific workforce. The aim of this workforce is to improve the health and well-being of patients and the public. Healthcare science is undertaken by a highly trained scientific workforce, practicing alongside doctors, nurses, and other health and social care professionals in the delivery of healthcare. Healthcare science is critical, not only for the delivery of current healthcare, but also to develop innovative tests and treatments for the future, in light of scientific discovery and the evolving needs of patients and carers. Whilst scientific practice is extremely varied, common to all approaches is the application of scientific principles and understanding to improve human health and well-being. Members of the healthcare science workforce perform a range of different roles depending on their qualifications, experience, and level of specialism. Healthcare scientists provide an extremely important contribution to the diagnosis of diseases and monitoring the treatment of patients, delivering almost 1 billion diagnostic tests every year. Advising, diagnosing, interpreting, and treating patients are examples of some of the work they undertake. Others include advising health and social care professionals in the diagnosis and treatment of patients, researching the science, technology, and practice used in healthcare to innovate and improve services, designing, building, and operating technology for diagnosing and treating patients, ensuring the safety and reliability of tests and equipment used in healthcare. Our degree programme will be based on the Magee campus of Ulster University. Known for its friendly village vibe, whilst located in the heart of the city with its impressive buildings, this historic campus has all the characteristics of a traditional academic institution, complemented with cutting-edge research and teaching facilities, including an 11 million state-of-the-art teaching centre and a 1.3 million library transformation. The Magee campus is located in the northwest of Northern Ireland and a short distance from County Donegal, therefore ideally situated for exploring some of Ireland's most dramatic landscapes. The city of Derry/Londonderry is full of history and is a great place to live and study. So today for this presentation, I will go through the following. Why study at Ulster? What will you learn in our degree programme? How will you be taught? How will we support you? Hear what some of our students think from past experience and some future career options following graduation. Okay, so first of all then, why study health physiology and healthcare science at Ulster? At Ulster, we pride ourselves on students having an excellent academic experience. This means that the methods we use to teach you are the most up-to-date. In university, class sizes can be quite large, so for your clinical skills teaching, we complete this using small group formats. We do this as we know this is the best way to allow you to practice these skills, perfect them to proficiency, and then present them ready for assessment, whereby we can sign you off as competent prior to embarking on your clinical placement, which will occur in hospital sites across Northern Ireland and in some cases further afield. Our facilities are furnished with the most relevant practical learning equipment, including the skill of venipuncture, which will be practiced from a mannequin with artificial limb and vascular supply. By using this type of equipment, we can simulate all types of scenario to prepare you for the clinical workplace. Teamworking, communication and reflective practice is core to our programme, and students are trained to a high level in these skills across the academic and placement components. Our students develop analytical skills during the programme, including reading and processing large quantities of material, judging the relevance and accuracy of information, taking effective notes and analysing documents for bias and the structure of arguments. Evidence-based practice is a strong feature of the programme, alongside using research to inform practice. These high-level intellectual skills are extremely important in the job market. So what can you expect to learn during your course of study? Cardiovascular and respiratory diseases are the leading causes of premature death worldwide. This course focuses on the diagnosis and treatment of disease and equips you with practical skills to carry out cardiovascular and respiratory investigations commonly used in clinical settings. The overall aim of the course is to produce graduates with a critical and scientific understanding of human anatomy and physiology and the physiological measurements that can be made in the clinical setting. The course aspires to produce safe, competent, reflective healthcare science practitioners who are committed to continued professional development in order to meet the needs of changing populations and employment context. This course will equip graduates with the entrepreneurial skills to be creative and innovative in the development of the discipline and practice of health physiology and healthcare science. The healthcare science programme is designed to ensure that the healthcare science workforce is fit for future practice, meets the requirements of the practitioner training programme, and registration with the Academy of Healthcare Science. The Health Physiology programme is designed to prepare graduates for the myriad of health-related career opportunities, which include education, health promotion, health communication, medical devices, and sales and marketing. Graduates from both the Health Physiology and Healthcare Science programmes will have the skills to work as key members of multidisciplinary teams, having developed the knowledge, skills, and associated personal qualities and behaviours needed to work safely and effectively. They will recognise that science and innovation are at the heart of high-quality healthcare and client-based outcomes. Students completing a health physiology or healthcare science degree may wish to undertake further study towards an MSc or PhD. Alternatively, they would be eligible to apply for further training in a scientific discipline, for example, the NHS Scientific Training Programme. Other opportunities include undertaking further study in medical school, teaching, or clinical research. We will provide a lot of training using equipment, and that includes stethoscopes, blood pressure monitors, devices to measure and monitor vital signs, including spirometry and ECGs. The interpretation of physiology is the most challenging skill these programs will enable. This is because we are taking signals that represent body function, measuring them and interpreting them to afford a diagnosis. We will focus on providing solutions to abnormalities we detect through diagnosing, including using pacemakers to prevent heartbeats going too slow and rehabilitation exercises to improve respiratory muscles if breathing is compromised. So the overall aim of the course is to produce graduates with a critical and scientific understanding of human physiology and the physiological measurements that can be made in the clinical setting. All students will undertake the same core modules within year one. Students then can decide whether they wish to apply for healthcare science and take either the cardiology or respiratory and sleep route. Dependent on whether they decide to stay in health physiology or apply for healthcare science, they will undertake a number of core modules as well as some specialist modules. Those who transfer to healthcare science will undertake 50 weeks of placement throughout their programme. Those students who decide to stay in health physiology will undertake placement in their final year work-based module, which can be undertaken in a range of settings, including industry, research, or pharmaceuticals. All final years will also complete a dissertation project as well and will be supervised by one supervisor. Learning is very much hands-on and at a pace that you're comfortable with. We will support you by being there to clarify elements of your practice, but we require you to lead in your own development through independent focused study. Teaching will be delivered through lectures, seminars, tutorials, practical sessions, case studies, independent project work, group-based projects, practice placements, directed and self-directed reading, student-centred learning, including web-based resources and online discussions, study packs, and computer-assisted learning. Class contact times will vary by module, and at Ulster we pride ourselves on engaging you whilst you learn by incorporating a range of teaching modalities. So how will we support you? So you will be allocated a studies advisor and have student representatives throughout each year's study. Other support systems in place include one-to-one mentoring, dissertation supervision, student buddies, library resources, small class sizes, career sessions built into the degree, and a wide range of student support services available within the university. In response to COVID-19, the school has been active in delivering face-to-face learning where it is required to educate the student in the skills and qualities required to be a professional in the workplace. Some of the programmes were delivering face-to-face content throughout the pandemic and maintaining clinical placement opportunities so that we could progress students through to graduation. The face-to-face delivery has been supplemented with online synchronous and asynchronous delivery of educational material with large and small group activities. Student feedback on our programme delivery during the pandemic has been very positive. We welcome a diverse student population. Gabriella Bretto is an Italian student who chose to complete health physiology at Ulster. She described the programme as memorable, innovative and professional. As a graduate, you will join over 50,000 professionals working in the field of health physiology and healthcare science. The course will equip graduates with entrepreneurial skills to be creative and innovative in the development of the discipline and practice of healthcare science and health physiology. This slide depicts an overview of the undergraduate health physiology and healthcare science degree, including detail regarding career opportunities following successful completion of the programme. Also included is information regarding the topics that will be covered and information regarding teaching and assessment. Courses are continually reviewed to take advantage of new teaching approaches and developments in research, industry and the professions. Please be aware that modules may change for your year of entry. The exact modules available and their order may vary depending on course updates, staff availability, timetabling and student demand. Please contact the course team for the most up-to-date module information and course lists. So the entry requirements are published on the Ulster University website. For information on equivalencies and questions around specific circumstances, please email admissions@ulster.ac.uk. We wish you the best of luck with your application, and myself and the team look forward to welcoming you into the programme. Thank you for listening.